Aloha and welcome back to the Kupuna Connections television program. I'm Cullen Hayashida, the host for this show, brought to you by St. Francis Healthcare System of Hawaii. Today we have a very interesting program on hospice care and hospice care related to comforting care. And before we get started, I'd like to ask my guests to introduce themselves, starting out with Felicia here.
Thank you. Thank you for having us. I'm Felicia Marquez Wong. I'm a social worker and the manager of the social work and bereavement team at St. Francis Hospice. I've been there for 21 years.
21 years. Wow. Okay. And Valerie.
Hi, I'm Valerie Murray. I am the home hospice manager. I take care of all the home hospice nurses, and I've only been there for the last 5 years.
Okay, okay. A real nurse.
Yes, a real nurse.
Great. Okay, so we're talking about hospice care, a topic that some people find to be quite difficult to talk about or uncomfortable to talk about. But it's an important topic that perhaps will help us round out our life here while we are here in this world. But let's start out by perhaps helping our audience, our visitors, understand what hospice care is all about. Now, what can you say about that?
Okay. I think the one thing that we need to remember about hospice care, and you're right, it does scare a lot of people. They consider hospice care being the last thing that they're going to do or the last care that they're going to be given. But in reality, hospice care is a specialized care. It focuses more on quality of life. So it's when you have a disease and you've reached the limits of that disease process, or you've been given a diagnosis of a terminal diagnosis. So there's nowhere further for the treatment to go. So now with hospice care, we can come in and we can offer that specialized care where we focus more on comfort rather than cure.
When you say comfort, what are we talking about here?
So when it comes down to comfort, so those would be being able to go home rather than staying in a hospital. You're home with your family. Unless home is maybe in a care home or a foster home, you consider that home, that's still home. But when it comes to comfort care, we focus more on medications. We focus on helping the family care for you in your home. So when it comes down to the medications, it would be something that will help you breathe a little easier, help ease your pain. We want to make it so that your life is more comfortable.
I see, okay. And so, how do you know when it's time to ask about, I mean, it seems as though, to a certain extent, when you say, well, I want hospice care, it's almost like saying, am I saying I'm giving up?
I think that's a lot of people have that thought. They do feel like, and that's why it's hard for them to make the decision to choose hospice care. But the way that we look at it, the way that our nurses look at it, our social workers, we look at it as a chance for that person to get an opportunity to get better care. And what that care is it's more focused on, like I said, we're not curing anymore. We're just treating you to keep you comfortable. So it's when you look at hospice care, you're either diagnosed with a terminal illness or you have a chronic disease that has reached its limits. The doctor can no longer give you any treatments that will cure you. Mm-hmm. So you may want to look at hospice care. The sooner we come in, the better, because then we can sit down with you. We can help you understand your disease a little bit better. We can understand where your disease is going to go from this point of not looking at treatments, not looking at going into a hospital every time you get sick, but being able to stay home. Mm-hmm. And you have a question in the middle of the night, it's 2 o'clock in the morning. You don't have to wait till that very next day to call your doctor. We have nurses on staff that you can call in the middle of the night and say, hey, my mom, my dad, they can't breathe. What do I do? You don't sit there all night long waiting, panicking to talk to your doctor the next day. Instead, you get to talk to a nurse, and that nurse walks you through it and says, You've got a medication at home. You've got oxygen at home. Go ahead and use those things. Make your loved one comfortable. So it's neat.
I see, I see. So when you say trying to decide when you should approach or have this conversation about needing hospice care, the sooner the better, is what you're saying.
Yes, definitely the sooner the better. A lot of times we'll get our families or we'll get our patients late in life, and we don't get to go in and have that opportunity to get the family ready, get them prepared, get the symptoms under control so that they have a nice, peaceful, comfortable, quality.
Now, you said sometimes you've got some people that just have chronic disease that there is no cure for. Now, many older people have a number of chronic conditions that they have no real cure for, right? But there's no terminalness, or it's not necessarily clear as far as when people will pass away. So is it still possible for them to consider hospice care?
A lot of times it's a determination when they go in and they have a conversation with their doctor, and the doctor decides that what disease process they're in, if it's a chronic illness or if it's a terminal diagnosis such as cancer, the doctor will say that disease process within 6 months or less, that determines their hospice eligibility. Now, that doesn't mean that you have to die in 6 months. It doesn't mean that you're only going to be around for those 6 months. We have patients that have been lucky to be with us for over a year or more.
Or to graduate.
And they might graduate from hospice. Which,
Oh, is that right?
Which means that they came into the hospital, they were really sick, but then when they got home with their loved ones or they got home with a consistent caregiver, they started to improve and they got better. So then they'll be taken off program, and then later, should they need us, they just give us a call, and then we go back on and take care of them again.
Oh, okay. So you made some reference to eligibility. Tell us a little bit about who's eligible and who's not. I mean, what can you share about that?
So when it comes down to the eligibility, our nurses will go in, and so they'll look at the charts. They'll look at what the doctors have done so far. Usually the diagnosis or the referral will come from a physician, or it'll come from a hospital, or it'll come from a family member. So the nurse will go in, they'll take a look. Has there been a decline in the patient's status? Has the patient, has the patient declined enough? Has there no more further treatment? So it could be something like they were on dialysis for years. Now they decided their body just can't tolerate the dialysis anymore. Every time they go for dialysis treatment, their blood pressure drops. Their life's on the line every time they go for dialysis. So instead of choosing dialysis to go further, they'll say, let's stop the dialysis. Let's take a look at something else. And then hospice can go in and control the symptoms and make them comfortable. So that would be kind of one of those kind of situations.
I see. But with regards to eligibility, is this partly related to insurance?
So all the different types of insurance usually will cover hospice care, Medicare, Medicaid, your commercial insurances, your TRICARE, your CHAMPUS, and then some people will self-pay for when it comes into but most of your insurances will cover it.
Okay.
It is an option.
Okay. So when we talk about hospice care then, is this always at home? Is this in the hospital? Where's it provided?
So ideally when it comes to us, home hospice will be in their private home, or it could be in a nursing facility. It could be in a foster care home. You could also in the assisted living facilities. We also, those are mainly a lot of the places that we'll go. So it's wherever that person considers their home. Because a lot of our patients, they've been living in a foster home for years, or they've been living in a care home for years. And to them, that's home now, because they no longer can go back to their own homes, or they don't have a caregiver at home to take care of them. So that's where they live.
I think you mentioned a little bit about insurance, and I guess that implies something about payment, right?
So the hospice is it's a benefit. So there's only a set fee that we get for each patient. It doesn't change with each patient. The hospice benefit just covers everything that we offer. So it covers our medical director that goes in. It covers our nurses that go in. If we have nurses aides that go into the home, it covers that. Covers our social workers, our spiritual services team, and then later down the line, it covers our bereavement team.
And the bereavement team will follow them 14 months or 13 months after the death.
Afterwards. And then what about room and board? Can you share a little bit about that cost?
So the room and board option is a little bit different. So it depends on your type of insurance. So when they come onto the program, those are the things that we'll check. So a lot of your private insurances, depending on what's chosen, it'll have 100% coverage. And then it'll cover that when they go into the nursing home. Medicare will tend to cover different nursing homes. Medicaid, you have to apply for it, and it might cover certain things. So it just depends. When they first come on program, we have our staff that looks at that and will let the families know what is covered, what facilities they can use, and what their options are. So it makes it a little bit easier. You know, they're really good at looking at that, and our financial department's really good at knowing what the benefits cover. And that way they can let the families know.
I see.
Yeah, it's very individualized.
Yeah.
Very individualized. I see, okay. So when we start talking about hospice care, we're talking about end-of-life care, this conversation that you have as a social worker, as a nurse, what do you discuss? How do you talk about topics such as this?
Okay, so if we're looking at what, where, when, why, how, so
Okay.
what would be something like, you would bring it up in a very simple and non-threatening way, and you would use current events, such as if you were to hear an ambulance nearby, you may talk about, wow, we hope that this person will be okay. And, what if this was to happen to us where, suddenly something happens, or the long-term illnesses will require assistance by people. Have that dialogue with your family and your friends.
So when you talk about what, it's not about what the disease is all about?
Yes, you could talk about the disease process. It's important that you have also that discussion with your doctor in terms of what the process is going to be like. But having that discussion with your own family members so that everyone's on the same page. And it's not a one-time conversation, it's a process. So when we're talking about where are you going to have this discussion, you have it anywhere. And you have it when you're gathered, in big family gatherings, and then you could talk about funeral services maybe, or if this was to happen, I think this is what I would want. And for me, I find that when you're driving and you have family in their car, that's the best time to have a discussion because it's a captive audience.
They can't walk out, right?
They can't walk out, and so you're either trying to finish a conversation or you're solidifying a particular plan, whatever that may be. Yeah, and in terms of when, it's here, it's now, and we shouldn't be waiting for the moment of death or the moment of dying, but you have that discussion right now. In terms of why, because it's a gift to your family that everyone knows your wishes, and that it also adds to your ongoing relationship with your, with your loved one.
Yeah, and so it's also a way for the rest of the family to honor your wishes too.
Absolutely.
I think that's the hardest thing. So when you're in a hospital setting, coming from an acute hospital setting where I came from before, is that the families did not have those conversations. And even though the family or the parents had chose what option they wanted, the children never had the conversation, so they didn't know. So then they would go in and override what the mom and dad had chosen.
Absolutely.
Yeah.
Because they wanted everything done.
Yeah.
But in reality, mom or dad didn't want everything done. They were ready. They had fought the disease as long as they wanted to fight it. They, in a sense, they were tired.
They were tired.
They were
yeah.
tired already.
Yeah.
They, not that they'd given up,
Right.
but they gave it a good fight.
Yeah.
They really tried.
Yeah.
It's just that their bodies were breaking down, and they were to the point where they just couldn't do it anymore. So it's always best to have that conversation ahead of time.
Absolutely. And
Yeah.
we often know people who've just been newly diagnosed with something. And so you pose that question. Suppose I was diagnosed with this disease and maybe given a prognosis. You know, let's talk about that. And what would you want? Or, you know, to say, I've been to a funeral recently and they added this nice ritual or this poem, and, you know, that's something I would like when it's my turn to go at my funeral, so that you have a say.
Yeah. And some people want to have it, have a nice article in the newspaper, and other people do not
Just
want
want something.
anything.
Right.
Yeah.
Some people actually write their
Write their
eulogy.
own. Yeah.
Yes.
And again, it's a matter of honoring people.
Right. Absolutely.
Yeah. I think the neatest patient that I had, he'd actually written his obituary
Yes.
because he said, my wife has known me for the time that we've been together, but she didn't know me before. And so he wrote his own, and that's the obituary that they used. Yeah.
Wow.
It was really neat.
Wow. Wow.
Right.
Yeah. So it's all about respect and honor. Yeah. And trying to recognize those wishes. This whole process, though, I guess, is also a very sad time because you're losing a loved one. So there's grieving involved. There's grieving involved, and I guess we have this one slide here that sort of captures this feeling. Can you share with us a little bit about how does one grieve with this? This kind of.
Well, we definitely do it uniquely and individually. But to know that it's a very natural, normal response to a change, transition, loss, or oops, it's supposed to be death, then it's, we all learn from those reactions that we have, and grief will certainly make a new person out of you, whether it be this newfound courage that now you're able to either take care of someone who's dying, or that you're now able to make some decisions that you've never made before. So with each time you grieve, there's something different about you. And so it takes time, and it also takes learning how you react when there's a change, or when there's a transition in life. And if it hasn't worked in the past because you get too frustrated, then maybe it's time to make some changes. That maybe, instead of reacting with frustration, that you're going to take some deep breaths before you have a reaction. So it's a combination of self-improvement and self-care that you have to incorporate during the grief process.
Is this something that the hospice staff or the group assists with?
Sure.
How does that happen?
The team is well equipped to provide that. Social workers, the spiritual care, the nurses, the bereavement staff after the death has occurred. And
I think we have a slide for this with regards to the kind of support, I guess, that
yes.
Regarding people that are in need of help.
Right. And the first one is really key, is that knowing yourself, knowing your limits, and knowing how you grieve. And that will help you to even support other people who are grieving. Because oftentimes when people say, no, I don't grieve, then, there's something's missing there, right?
Yeah.
And then you also need to know your own balance, because how are you to support other people when you're not quite, that it's visible that you're not up to par. And the reason why I had listed listen is because too often we want to say something immediately when we want to support someone, but we actually need to take a step back, 2 or 3, and truly listen. And that means you're going to not think about the chores that you need to do or the tasks that you need to do, but you're going to be fully present to the person who you're trying to support. And from there, you validate, you clarify, and then you have to be very kind to people who are grieving because they're very, very sensitive, and you have to keep your promises. So oftentimes, you'll say something like, I'll call you for lunch, and then you end up not doing that, and we sometimes remember that you said that you were going to give them a call and you didn't.
Keeping promises, yeah.
That's very, very important, yes.
Okay. Yeah. Listen. That's what my wife tells me. I have to get hearing aids.
She's a wise woman. Yes.
Well, but yeah. So these are important tips to keep in mind.
Yes.
So with regards to what do you say to this grieving person? I guess part of that, what you shared was part of that, but. We've got another slide that points out some of your pointers as well.
Absolutely. Saying that you care, that you're sorry, and asking them, how do you want me to support you? Or tell me what I can do for you. Those are really helpful because sometimes they may know, but they don't want to share, or they're waiting for you to maybe ask. And this way, it's a win-win situation. Can I do an errand for you? Can I bring you a meal or something like that? So again, focus on being very kind to people who are grieving.
And sometimes I suppose people are hesitant even to say, well, it would be nice to have a meal prepared for me. But sometimes maybe it might be better just to bring the meal, because oftentimes they don't want anybody to be inconvenienced. Yeah, so it's a fine balance, I guess. Yeah.
Sure, and then when you bring a meal, put it in a disposable container so they don't have to worry about returning it to you.
Oh, that's good. Yeah. But yeah.
And I think you're very right about that, especially in the local culture.
Yes.
They're not going to ask you.
They're not going to ask. Yeah.
So if you volunteer it, if you just go ahead and do it, that means so much more to them.
Yeah.
And they may never be able to repay just that little one time that you came, but it means so much in that grieving process.
Right.
Because maybe they haven't eaten all day.
Right.
Absolutely. And
right.
that one meal you bring that was made with love.
Right.
How much more does that mean to them?
Right. So, absolutely, yeah.
Right.
And people do feel oftentimes uncomfortable, right, about how best to approach you because you're grieving, and they're not quite certain what to do, and so they stay away.
Right.
Yeah? So some of these points that you made are excellent.
And I think that's the hardest part is when you do stay away, it depends on how that person will take it, because maybe they think you just don't care.
Right.
Yeah.
Maybe the words that you said just fall on deaf ears because now you're not showing the actions.
You're not even showing any action whatsoever.
It's very difficult.
Yeah. Now, here's another thing about what don't you say appropriately, what don't you say to a grieving person. We've got another slide here.
Yeah, saying that you know how you feel, and that's really a no-no because you don't know how.
You don't know how you feel.
You can have the same relationship in terms of maybe your parent died and that person died, but it's still different. Yeah, you have a different relationship with your loved one. He or she is in a better place. Oftentimes families say, no, the better place is here with me.
Here. Yeah.
And the don't cry, wow, that's a little tough because, you want the toxins to be released. out of
Yeah.
your system. So encouraging them to cry is actually pretty good. And when you say to them, be strong, maybe they have been trying so hard to be strong. And by you telling them, oh, you need to be strong, it just kind of defeats the, what they've been trying to do.
How about when, as a person that's coming over to comfort, you start to cry? I mean,
I guess sometimes that happens
that
as well
happens
too. Yeah.
And I mean, these are of course people that we're going to be missing. So it's understandable. Of course, that sort of creates a chain reaction too, of course. And I mean, but.
And, and that's okay. Sometimes you'll cry together, and then other times what's going to be really tough is, here you're trying to comfort someone, and you end up comforting them because of their own loss.
Yeah.
So you need to kind of.
Okay. I think we're just about out of time right now. So what I wanted to do is show this one last slide here with regards to some phone numbers. If you could kind of fill them in case people want to contact, want to share some.
So the number that's on screen, the 595-7566, is the number to call if you have a referral or if you just have any questions that you want answered regarding hospice. The website is excellent, the www.stfrancishawaii.org. We've got a wonderful website that shows all of the different services that our hospice and our company offers. So you can go on there and it gives you some answers to some of the questions that you probably have.
Mm-hmm.
Okay.
Yeah.
Okay, that's great. So to end this discussion, we've covered so much, and perhaps for our viewers out there, if there was one last tip that you could point out, what would that be?
I think to continue to have that conversations, to research on your own. Check out Kupuna, look at some of the things that they have on their website as well, and then
Kupuna,
yeah,
Kupuna.org.
Okay. And then you can start with your conversations with some of the pointers that they have out there.
Okay.
Yeah.
And Valerie, any last?
For me, I would say have the conversations early, get the hospice conversation going already, and get the referrals in where we can go in and do the most help. Yes. And we can be there for you, and we can give you that support that you need.
Okay.
Because we love to do it. That's what we enjoy doing, and that's why we do what we do.
And you guys are good at that, right?
Thank you.
Yeah.
Thank you.
Okay, thank you very much. So this is all the time that we have for Kupuna Connections television program, and see you again next week. Aloha.